Welcome to the Monday Manager Show. Today, I have a very special guest, Erica Leer. She has 20 years of experience in the global development sector, but she didn't start out that way. She was a chemistry major who then moved into the sector. She has spent 10 years working in Africa in health research and product space. And then she got hit hard with the USAID shutdown and now has transitioned to being a fractional COO for a lot of health and technology startups. So, very interesting career journey and filled with insights. I hope you'll enjoy this conversation. Hi, Erica. Welcome to the Monday Manager Show, my fledgling podcast. I'm very excited to have you here as a guest.
Hi. Well, yeah, great to be here.
Great. Um, do you mind if we dive straight in?
Sounds good.
So I was going through your profile and you studied chemistry, right? And then from there you went to Africa where you worked for many, many years across the health and health tech space and product space. And now you're a fractional CEO. Like, so how does a chemistry major make those transitions?
That's an
Can you
excellent
talk a bit
question.
about that?
Yeah, no, absolutely. And I mean, the first thing I'll say is that I used to think I had a plan. I had everything planned out, 5 years, 10 years, this is where I'm going to be. And over time, I've realized that it's nice to have that in mind, but life does not go according to that plan, and you need to be open to things that come around and opportunities that excite you. So yes, I studied chemistry. I did it because I loved it. I found that it was one of the it really stimulated my brain. I have a very analytical brain. I really enjoyed the topic, so I just kept taking more and more chemistry classes until I had a major in chemistry. I actually had planned to get a PhD in chemistry and to become a university professor. So
Oh,
that was my plan. I had applied to PhD programs. I had been accepted to multiple programs when I was finishing my university studies. But after my junior year of college, I took a trip to Uganda and Rwanda through my university. And quite honestly, it changed my life. It opened my eyes to a different part of the world, new cultures, new challenges that existed. And from then on, I just had a feeling that I needed to go and do something after university, that, studying chemistry, working in a lab for 5 years as I got my PhD, it just was not inspiring to me. So I decided to join the Peace Corps. So the Peace Corps, has been around since the 1960s. It's a US government program that sends people of all ages, but largely young, idealistic university graduates to low income countries throughout a number of regions: Africa, Latin America, Asia. And I was placed in South Africa. And so for 2 years, I lived in a very, very rural village that was about an hour and a half away from the nearest grocery store or town. I lived with a lovely family, and I was working across three primary schools. And basically, my job, I suppose, was to work with the teachers to help strengthen the science curriculum within the primary education programs, but also within that process, I got very involved in facilitating life skills courses with teenagers in the community, and doing a lot around HIV prevention. And that was really my first exposure to public health. And what I realized is that I loved it. I had such a passion for public health and looking at broad population level challenges, and thinking through ways to put in place education and interventions to support people's health. And so that's then where I decided to make a bit of a shift and pursue a master's degree in public health, international health specifically, rather than chemistry.
right. And were there any doubts in your mind when you were making that shift? Like, hey, I've already spent so many years now studying chemistry, now I'm making the shift. Was it easy?
It was easy, and yes, I had spent a lot of time, and part of me thought I was kind of giving that away, but I'll be honest, there's a feeling that you get inside when you know something is the right course
Mm.
of action and direction. When I made the decision to join the Peace Corps, that was one of them. I had been going back and forth for months, and then I just said, this is what I want to do. and I knew with such clarity. And it was similar with my master's degree. I realized that the idea of becoming a professor, it just didn't light me up anymore. Like, yes, what I loved is teaching. I loved engaging with people and helping people. So it was less about chemistry and it was more about that ability to engage with people. And that's something that I could very much do in the public health space. So I really never looked back once I made the decision.
Right. And as a, and then right after you did your MPH, you again went back to some research projects in African countries, right? So
Yes.
what surprised you from what you learned in school in when you were doing your MPH versus when you were actually then you entered and you started public health research work? What Where did you notice differences?
There were a lot. So, I mean, basically, so I went to Johns Hopkins University for my master's. For 1 year, I had classes, and then I moved to Tanzania, and I had a fellowship that allowed me to do independent research. So I moved to Tanzania for what was supposed to be 10 months, and I ended up staying 9 years, which was never, again, having a plan. And then things change and life happens. But yeah, I guess real life is a lot messier than academic life. I think that's one of the main main takeaways. I mean, I moved to Iringa, which is in central Tanzania. I had a research topic. I hired amazing research assistants who I learned so much from, and we conducted a research project around. We were looking at that point at women's experiences with male circumcision programs for HIV prevention, and there was a lot of really interesting findings. I think a number of things came up in that initial engagement, one of which is there's science, right, that shows that men who are circumcised have a 60% lower risk of transmitting HIV.
Mhm.
And then there's a lot of gray areas around that. So, yes, they are at a lower risk, but if the man is already HIV positive when he's circumcised, the risk to women can actually go up. And the way that risk reduction is communicated in communities, it wasn't working. And that was one of the main findings that we found. And it was interesting because there was another organization that was implementing massive large scale programs, and their goal was to get as many men in and out the door as possible. And we had some findings that kind of contradicted that, to say, we need to really focus on how we're communicating and engaging with women so that they can protect themselves. And I think the harsh learning that I had from that is, at the end of the day, often decisions are driven, especially in development, around numbers. And we just want the biggest numbers we possibly can, even if, there are reasons that we should take a step back and we really need to think about individual understanding and risk factors. So that was kind of a harsh reality. And to be honest, that influenced me as I moved into my work with Dietrich, which we can talk about, I'm sure, but it was a very small organization founded by a visionary leader, Dr. Mark Mitchell. And he was adamant that the overall landscape of kind of the global health space was often focused too much on numbers and
Yeah.
fancy reports. And he was squarely focused on impact. And I think that has really influenced my life a lot in learning from him. Um, and understanding, really putting a focus on impact first, rather than appeasing a donor, let's say, or getting higher numbers.
Right. And how is the definition of impact that you came up with or what you learned different from the understanding of at that time when what you are talking about, the definition that donors had in mind?
So some donors more than others, I think, when they look at impact, they look at volume. So they want to have mathematical models that show that if this many people receive a treatment, or this many people get this education, then we can model out some kind of an impact. And so the goal then becomes to scale as quickly as possible and to reach as many people as possible.
Right.
Now, what I've seen in doing a lot of work over a lot of different spaces and topical areas is scaling. is inherently challenging. And so even if we can show that there's a pilot that works well, if we're doing training or education or mentorship or some kind of a biomedical intervention, as you start to scale that, the challenges compound in ways that we can't really understand. And so often the donor agencies want to give a very small amount of money to scale something nationally, but they're not thinking through, what does it mean to operate at scale? What is the decentralization that needs to happen? How do we think about training people in a way that we can cascade that down and keep the quality and ensure that that quality stays? And so often that's not the case. And so that has been a major focus of work that I've done. To date, is thinking about how can we scale things effectively without losing that quality, and without losing the
Mhm.
impact that we're working towards.
Right. And do you think that there is an essential conflict between the way pilots are designed versus the larger objective of scaling?
Yes,
And
very much so.
what might that be?
Yeah, I mean, first of all, pilots are often very well funded, right? And there's often a lot of oversight in terms of what's happening. So if there is for example, in the digital health, I know we haven't kind of talked about that yet, but in the digital health work in the early days when I was with Dietrich, we would have a lot of pilots, and every single day somebody on the team would call every single health worker to ask how they're doing and to troubleshoot issues with them and to review their clients and make sure that they're following through with their visits. That kind of support is never possible when something goes to scale. So that's one. And I think another is that often pilots are NGO driven, like they're driven by a private organization. And then the idea is always, and then we pass it to the government, and the government is going to scale. And that's the other thing is, the government is often not the one that's completely designing the program, and they don't necessarily have the systems in place and the capacity in place in order to then take things forward. And that's one of the
Hmm.
major challenges that I've seen over and over again with kind of taking a pilot to scale.
And how do you then design better pilots? Like, because you do need pilots, right? For
Yeah.
new ideas to be tested out and things like that. But there is this inherent problem that, the effort, like you said, that is put into the pilots and the resources and the external expertise that is at play, none of that scales to, say, public systems. So, how do you design better pilots?
Let me give you a very concrete example because I think that will help. So
Yeah.
we haven't talked about it yet, but after I did my research, I stayed in the research space for a few years in Tanzania, and then I shifted over to work with Dietrich, which is a digital health organization, really focused on clinical decision support tools for frontline health workers to support community health workers and primary health facility workers, nurses, and clinical officers, to provide higher quality standards of care to allow them to better follow up with their clients using simple decision support prompts and mobile apps that really guide them through the visits. And then as a byproduct, creating data that can be used for health information systems and decision making and
Right.
supervision, importantly. So in Zanzibar, we had been working with them since 2010, actually, and started with a very small, very, very small pilot, to try to see if digital technology used in a way, providing decision support, could help community health workers and also traditional birth attendants to engage with pregnant women, to increase rates of facility deliveries because many women were delivering at home. And so we engaged very, very closely, I think, with the government from day one. And of course, we had some smaller pilots, and then as it got a little bit bigger, that's when the government really got engaged. But over time, it was really a joint collaborative effort between Dietrich and the government, to make decisions from a very early stage about what could be sustainable and what could be scalable and what the government realistically has capacity to manage in the future. And our pilot was actually designed in that way. And so a lot of times, we kind of look at the gold standard of what's possible and do that for the pilot, and then things really shift as the government takes over. We tried to be very intentional and say, yes, we could probably do this better ourselves, and we could better resource this so that there's more early engagement, but we want to do it in a way that the government can actually really take that and scale it. And so, we built out strategies and policies. We put a whole plan in place to support and second staff to the newly created digital health unit, to the newly created community health unit. We really had an integrated approach, and we're thinking simultaneously about how are we showing impact, but also how are we building that capacity for the long term. And so we were able to then bring on donors to kind of co-fund and crowd in funding around this idea that, yes, it's a pilot, but it's being designed in a way that really can scale. And today the program has been nationally scaled throughout all of Zanzibar. It's been fully handed over to the government, and Dietrich is providing technical support rather than leading the program. And I think that's one of the biggest success stories that I've seen. And at the same time, we've been able to demonstrate, over 60% increases in facility deliveries, fourfold increases in postpartum follow-up visits. We've really embedded early childhood development and have some really interesting findings about improvements in parent-child interactions and other indicators around progressive early child development indicators. So it's been a really rewarding process, and I think those are some of the lessons that we learned about what true scale needs to look like.
Right. And like you said, you have spent more than 10 years working in Tanzania and other African countries. Was there ever a time where you felt out of place?
Hmm. That's a great question. I mean, absolutely. Absolutely. I mean, I'm very aware that, I'm a white American woman, and I have a lot of privilege that comes along with that. Um, I mean, one of the things I will say is that I think it's so important when you're living in a place that is not your home country to integrate. And so I learned Swahili. That's the very first thing I did when I
Mm.
moved to Iringa in 2010, and I became fluent in Swahili. So I was able to communicate with everybody. Really took time to understand the culture and appreciate. And it was a challenge for me sometimes, but I need to slow down and approach things within the cultural context that I'm working in. But at the same time, yes, I was very much external, and I had a very different perspective. A lot of our focus at Dietrich was finding great local talent and growing them so that they could take on leadership roles. And for example, now we have someone who came on as a project assistant who had just finished her studies, a Tanzanian woman who's now the country director, and finding ways to really elevate people. The team dynamics, I would say the makeup of our team has shifted dramatically over the years, and kind of with that mentality of, we're not coming in to parachute in and find a quick fix, but we're here for the long term, and therefore we
Right.
need people who are embedded in the culture and from these places, and that's been
Right.
a core value of the organization.
Um, what about the working environment for foreign professionals coming and working there, like you? Like, how they worked with the local people. Did anything change in the working environment, or the experience evolved?
Yeah, a bit. I mean, the biggest change, and I don't want to get into politics, but it was political. There was a
Okay.
leadership change within
Right.
Tanzania, and there was actually a shift, quite a major shift towards nationalism. And so, what I can say is there were a lot of kind of expats, foreigners in Tanzania in 2010 when I came, and there was quite a kind of a charity mentality, maybe,
Right.
where you need an external person to come in who has
Hmm.
this expertise in order for things to happen, which I don't agree with at all. I think there are times and places where, external people have very specific experiences that can lend itself to the challenges that we're trying to solve, but very much believe that we need local solutions to local problems. Over time, so then there was a shift away from that, and it became very, very difficult for expats to renew their work permits. Kind of the environment was shifting, and so a lot of non-Tanzanian people left over between 2015 and 2020. What I will say is what I've seen very clearly is the people who do the best work, I think, are from the country they work in, or they're there for the long term. So it's the people who
Right.
are fluent in Swahili, who understand the cultural context. Many are married to a Tanzanian national, for example, and they're in it for the long term. And we've actually
Mm.
hired a number of people at Dietrich who are, married to Tanzanians, and they're planning to stay there. And they're really, for many purposes, kind of they've fully integrated into society,
Right.
and they are much more effective in their roles. But I will also say I think things have shifted. Like there's a real capacity shift that's happened, and there are a lot um, more people who are coming back who are Tanzanians who are taking on leadership roles, and so the opportunity to just provide mentorship or external support is a lot greater now than it was before.
Right. Understood. Yeah. Um, and you made that shift from working on research projects to working in a product company, right? So how was
Mhm.
that shift like? Was that something you were intentionally thinking about doing, or did an opportunity come up and you jumped on it?
It was the latter. So I kind of stumbled into research. I never planned to be a researcher, but I did my master's thesis, and then I had an opportunity to stay on with my research team at Johns Hopkins to continue to do some research. But I knew that that's not what I wanted. I wanted to get more into the programmatic world. I was not planning to move into digital health, but this opportunity with D3 came about, and so I made this shift because, quite frankly, it was a job in Tanzania that I could do, and we wanted to stay in Tanzania. So it was very opportunistic. I met the founder, Mark, and I was really excited to work with him. I had very little experience in that space of digital health or any kind of product development.
Right.
It was also a really good fit, though, and this is where I think sometimes we need to be open to opportunities that come along, even if it's not at all part of our plan. I didn't know anything about digital health and technology and building apps, but I think part of it was going back to my chemistry days. Like I'm a very analytical thinker, and so one of the things I was doing first at Detroit was literally building apps. So going out into communities, following health workers, understanding their workflows, mapping that out in a document, and then we had a kind of a no code software platform, and actually building the logic and building the apps, testing them, piloting it in communities. And I loved it. I really loved it. It was just, I couldn't believe that I was being paid to do this work because it was just so inspiring to me. And I feel like it kind of brought together my analytical brain with also, the messiness of any kind of program implementation and engagement with donors and
Right.
government and communities. And so it was great, but it wasn't planned.
And what was the biggest surprise for you from how research projects operated versus how this product space worked?
To be honest, it wasn't as big of a difference as I had expected. I mean, we
Mhm.
were very data driven, and what we were trying to do, especially the early days at Tree, digital health was a very new field, especially in low income settings. And we knew that if we wanted to succeed, we needed to demonstrate the effectiveness and the impact that we could have. So we kind of had a research mindset on is making sure that we were using data to understand the baseline, to document the change, and then to publish on that. So in some ways, it was actually still some research, but I will say it had a much more practical, pragmatic approach to it because sometimes with research, you again, getting back to kind of these pilots, I was a part of a design for a combination HIV
Mhm.
prevention research program that I think it's like $60 million or something, a massive research program. And what happened is, the research and the implementation teams just kept adding and adding and adding more. Like, we want to test this and this and this. And, the question I always had was, we are going to see massive impact from this, but there is no way that that can scale because nobody can afford it. No government can afford to take this on. And so I think sometimes that is the mismatch between where research comes in, and it's great. We can show cost effectiveness of anything, but that doesn't mean that it's affordable. And so when I was with Dietrich, the question was really, is this working? And is this something that can meaningfully be taken up by a government with support from donors, but largely driven by government? So that was the big shift.
Right. Understood. And how did your shift to operations happen?
So that, yes, and this is another, I think this is maybe if there's a theme in my career, it's just being open to finding your passion and pursuing it and being open to new opportunities that come about. So I started at D3 as a product manager. As I said, I was building apps. I was, going out to very rural areas and working with health workers and, doing the projects. Over time, I took on more seniority and I had more strategic roles. So I was overseeing our all of our programs. I was supporting global expansion into Malawi and into Zambia. Um, and I was the chief program officer. And it was Mark Mitchell, who was our CEO and founder. He was ready to retire at, I guess it was 2018. And at that point, the organization wasn't terribly large. We didn't really have the finances to bring in an external CEO to take his place. And so the board asked me to step into this role. That was never my plan, by the way. I never intended to be a CEO, but it was an incredible opportunity because I was able to jump into something new. I had excellent mentors around me, and I built up a peer network within other organizations of other CEOs, and I just learned as much as I could.
Did
So I
you,
was took on the CEO.
sorry to interrupt. Did you have any apprehensions about taking the CEO role?
Oh, absolutely. Absolutely. I was terrified. I mean, the weight of taking over an organization, and to be honest, financially, we were not in a great position at that point. I had no idea what was going to happen. So yes, and I realized I had never done this. It was a massive bet that the board was making on me. But the board chair and also Mark, I had their full support. They believed in me. They were right there behind me. Like I really felt supported, and it gave me, I would say, enough courage to step into this. But I was terrified every single day. Absolutely. And the thing that helped me was building relationships with other CEOs of other companies and realizing that everyone else is just as terrified as you are. Nobody knows what they're doing. We're all figuring it out as we go. And that just helped me tremendously to feel like I belonged in that seat.
And was there any difference between how people treated you when you were the CEO versus when you were earlier working in different roles in the company?
I mean, absolutely. Yeah. Yeah. Having that title really carries some weight to it. So, I was being invited to attend different global conferences and to make high-level presentations. I sat next to the former Tanzanian president and talked about our work, and these are things I think that the title very much helped. I don't
And
think I
within the
felt any
company,
different.
and within the company itself?
Not so much within the company. I think, one of the things that I really appreciated about kind of my evolution was that I had, especially so I had a really strong relationship with our entire team. So I wasn't someone external coming in with this high level position. I was Erica, who was a product manager. I had been supervisor to our field team. Like they knew me and they trusted me, and so I don't think so much changed. And what I was able to do is to really build out an incredibly strong leadership team around me who were all better, I think, than I was in their respective like focus areas. And we had such a good rapport. It was all about the relationship. I knew everyone personally. I trusted them completely. They trusted me. And we were all really very much in this together. So we all saw this big, audacious goal. We knew that we were defying the odds if we were going to succeed. And I think that motivation carried everybody to just put so much effort in, and we worked so well together. And that, quite frankly, is the only way that I was able to succeed. I could not have done this on my own.
And how did you pick up these skills though? Like even building these relationships with people and things like that. These are not things that are ever taught to us, right? So
No,
how did you pick that up? Because many people struggle with that.
Yeah, yeah, absolutely. I mean, it was a combination, I would say, of finding well, most importantly, finding the right mentors. So Mark, who was the founder, and then our board chair, were tremendous in just helping me and being that safe place where I could be vulnerable and say, I have no idea what I'm doing in this area, and they were able to support me. I also found a couple of sort of peer mentors in other organizations, and I learned so much from them. So um, it was that networking piece. And then it was also, I read so much. So every time somebody would recommend a book to me, I would get it and I would read it and I would apply it, from value-based sales to developing OKRs within an organization to leadership principles to culture. Like I was devouring every single thing I could and then trying to really apply that. And again, having a leadership team that was so open to learning and to doing things differently and improving was really critical because that allowed me to kind of learn new things and then actually put them in place. And yeah, it was really that. And then just learning by doing, I would say pushing myself outside of my comfort zone. I mean, and this is part of the reason I've shifted over into the operations space, but I am not a natural kind of networker and fundraiser. I think when I fully believe in something, it's very easy for me to, let's say, sell that or show the value of what we're bringing. But things like going to external conferences or speaking at major events and cultivating relationships with potential donors, that was never easy for me. And so
Right.
I worked with an executive coach who was fantastic, and that was one of the main things we worked on is helping me to push myself outside of my comfort zone to go to these conferences, to force myself to believe that I belonged there, and I had value to add and really make that happen. And through that, we were able to raise a lot of funding for the organization. So we went in about a 2-year period from a $2 million a year to a $6 million a year organization. And that was a direct result of just getting out there and showing the value and really believing in the work. And I also think for me, having come up through the ranks within the organization, I could speak with a level of authority. I mean, I knew
Yeah.
exactly what we were doing. I had built the programs, I had the relationships, I knew how the apps worked, the data, the impact, and that allowed me, I think, to speak very genuinely about the work as opposed to, let's say, an external CEO who's more of a salesperson, that being genuine and showing that and understand and believe in what you're doing. I think that was the reason for a lot of our success.
Right. And looking back on the time that you spent working in Africa, what was the biggest failure that you encountered?
Oh, there were lots. There were plenty. I
Which is
think
your favorite failure story?
so. Yeah, okay. Favorite failure. Let's see. So we had been working with a consortium to build a digitally enabled emergency transport system. And this was in mainland Tanzania, so up in the northwest corner of Tanzania. We built a system where very, very simple and low tech. If there was a maternal or newborn emergency, somebody could call a toll-free number. They would get in touch with a dispatcher who had then an app where they could triage, and then they could identify if it was an emergency, if there was an ambulance nearby or community drivers, organize the transport, and then bring women to the hospital. And the pilots were astounding. We saw a 27% reduction in maternal mortality. It was incredibly cost effective. I mean, it just for every reason was something that needed to scale. It has since scaled, by the way, but at the early days, we wanted to then bring that to Zanzibar because we were working with the Zanzibar government. We had a community health program. It just made sense. And so we put a lot of effort into kind of, adapting this tool. And we thought it was going to be just a shoe-in to have the government like enthusiastically sign on to this. And so we went to a meeting and I remember presenting this and basically being met with crickets. Nobody was supportive. There was,
Yeah.
people were hesitant about it. They didn't like it. They didn't see it. It was such an incredible failure. And it didn't move forward at that point. And what I realized there is it does come down to that having that cultural insight. Decisions do not get made in a boardroom. They get made in the hallways ahead of
Yeah.
time. And what we were missing within Dietrich was that kind of government stakeholder advisor who's has a foot in the door within the government, can back channel and have these conversations to get the input far before the meeting ever happens. And so,
Right.
that was a huge failure, but also a learning. And we shifted also our staffing structure, and we started to bring on more people who had been government employees their whole career and had, they could call up the Minister of Health, for example, and get meetings and connections, because that's the way that you really scale something,
Right.
is by having those high level connections. And we had focused more on the kind of the technical level.
Right.
So that
And
was a big
also the
learning.
context, right? Also the context within the government, what their priorities
Totally.
are and things like that.
Hmm.
And then you moved out of Africa, right?
Yes. So in 2019, just before COVID, we did move, and part of that was a result of, as I mentioned, when it got more difficult to renew work permits. For example, we were struggling to get our work permits renewed, and we realized that it probably wasn't going to be possible to stay in Tanzania. So I shifted to Switzerland. Um, still as CEO of D-Tree though for a few more years after that. And maybe just kind of to mention, as that we segue into the COO work that I'm doing now. I think that for me, one thing that I realized when I was CEO is I could do the work to bring in funding, the big vision thinking, the external engagement, the networking. Like, I could do it, but it was sucking my energy as I was
Right.
going. Like, I worked with my coach, I really put effort into it, but it just never got to a point where it felt energy giving. And I'm an introvert at heart, and it would just be so exhausting for me to do these activities. When we brought in all of the funding at the same time, we realized that we're growing really quickly, and we did not have the structure in place for an organization to go from 2 to 6 million, to go from 20 to 70 staff members, to go from
Yeah.
2 country offices to four. And so a lot of my focus actually shifted away from that external side to the internal side, to the putting the structures in place, putting the supporting our teams with professional development and capacity development, as we promoted so many people from kind of technical roles into leadership roles, to putting accountability systems in place, to having a clear vision, all of these things that are needed to actually execute and deliver on those promises. And what I realized is that that is what lit me up. Like, that's what I
Right.
got so excited about. And I did so much learning on this, and I put so much focus on it. And so I think over time, I was basically playing the role of the CEO and the COO, or that integrator position. And I realized over time that that's actually what I want to focus my efforts on. So
Right.
over time, I did step down as CEO as D-Tree got to a point where it basically needed a CEO that was externally facing. Like, that's what we
Right.
needed. We needed someone traveling. We needed to go to conferences to meet donors. And I had just had my first child, and I didn't want to be traveling. And I also knew that this was not where my passion was anymore, was that external side. So I started to kind of shift over more to looking at the internal operations and strategic operating partnership that I wanted to play.
Understood. And Erica, what was different about being CEO while based in Tanzania versus being CEO based in Switzerland?
The big shift is when I was in Tanzania, I was sitting with our team every day. I was with our team. I was going out to our programs. I was having meetings with governments. I was having meetings with partners all of the time. And that gave me an incredible amount of insight into the work we were doing. But I will say, when I moved to Switzerland, and Switzerland is a very strategic place because, there's our biggest funder,
Yeah.
the Fondation Botner, was based in Basel. And then, of course, in Geneva, it's kind of the global health hub. And so from Switzerland, I had much more access to donors and decision
Mm.
makers and conferences and that external side. So I am forever grateful that I had the opportunity in Tanzania, and I think I was effective because of it. But I do think as teams grow, it's a lot harder to go from Dar es Salaam to London, to meet with a donor, than it is to go from from Switzerland, from Geneva to London, and I had a lot more access to that external side. So I think, as a CEO and where the organization was, it made sense, but I did start to feel more and more disconnected from the team. So it's definitely a push and pull. But I can see benefits of both.
Right, understood. And so what you're also saying is that as an organization grows, um people's profile, the profile of leadership that it needs also evolves and changes, right? Because when you're a smaller one, you need a more hands-on CEO who's focused internally, getting things right, and perfecting the product. And once you start scaling, then you need to one who's bringing in more funding and things like that, right? And that's when you need probably a COO who can look inside the company and make sure that it's running well, right?
Absolutely. And I think it's the roles that change, and it's also the specific people. And I think that's okay. What's needed for a leader, and this now goes into a health tech startup world, which is where I'm working in more now, is that the person that's going to get you from zero to, a million or 5 million in revenue is probably not the same person that's going to get you from 5 million to 100 million. And that's okay. And I think sometimes we think that people need to be able to do everything. And one of my learnings over time is you need to be able to do what an organization needs right now and do it really well, and also recognize when it's time to move on, and when your skills can be used better in a different way. And I'm grateful that I was able to step away from Dietrich when I did, because I think I was exactly what they needed at the time. But as we grew, like I just that wasn't where I needed to be. And yeah, so that is absolutely true.
And when do you recognize that, okay, now the time has come that I need to make a change and I need to move to something else that is more aligned with how I want to grow? Like, was there any particular moment that you remember that it struck you that, okay, now maybe D3 needs something else and I need something else?
Honestly, I don't think it was a moment. It was a process. It was something that happened slowly over time, but it has to do with listening to your gut and your inner passion. And, for a long, long time when I was CEO at Dietrich, I mean, I was just lit up. I was so inspired. I had so much energy and so many new ideas. And, there were challenges and I was excited to tackle them. I was reading books. I was, talking to people. And over time, I sort of just slowly realized that passion was diminishing. And when I started to pay attention to that, I realized that, I'm not necessarily in the right place anymore. And I think I need something else and the organization needs something else. And I can tell you now, I've just now launched a fractional COO business, and I have that passion. I have that spark every single day I wake up, and I can't wait to get into my work. And I love that. And, I think it's this matter of just continuing to listen to that and make sure that you're attuned. Sometimes we think that we're doing something wrong if we're not feeling passionate anymore, but it's normal. It's a part of life, and just figuring out where you can add value and have that passion is the most important thing we can do, because you add so much more value when you have the inspiration to do what you do.
Right, understood. But you didn't come to the realization that, okay, fractional CEO work is what you need to do. There was a trigger,
Mhm.
and a rather painful one, right? So you want to
It was
talk
a big
about that?
Yeah, absolutely. So I left Dietrich in 2022, I think. And then I was working for a few years, kind of with a couple of organizations, but largely in kind of COO roles, but still in the global digital health space. So I would say it was a safe a safe transition. It was similar, I knew the same people, it was the same field, it was comfortable. And that was great because I needed comfortable at the time. I had two kids and life was a bit crazy, and I was able to work part-time, and it was great. And so I was kind of just moving along. I would say, I was happy with what I was doing, but didn't necessarily have that spark. but I probably would have continued doing that for a while because, my personal life was a bit stressful. And this is what I wanted. And then just about a year ago now, of course, as we all know, USAID was very quickly dismantled overnight. And so from literally one day to the next, we went from having a strong pipeline for 2025 and beyond with donors lined up and kind of a strong financial forecast to every single donor turning and saying, we didn't have USAID funding, luckily. So we were okay throughout the year, but every donor that we were anticipating that would come on had to shift their funds for emergency support because of the immediate withdrawal of USAID funds. The entire sector just almost collapsed overnight. And, from one day to the next, almost my entire network lost their jobs. Organizations went out of business. We know that the human toll, the number of preventable deaths that are happening because of this restructuring, are in the millions. And so it was devastating. So yeah, February of last year was one of the hardest months of my life. We went from feeling very good about things to feeling like we have no idea if there's even a sector or a field. Um, Jobs were getting literally thousands of applications, and I went from a point of I've never really looked for a job. I have a strong network and I was always very confident that if I want to look for something else, I'll just talk to any of these 20 people and they'll give me work because they know me and they know the value of what I do. But all of a sudden, these people had lost their jobs as well. They were out of work and they were trying to figure things out. So yes, it was an incredibly difficult time. And I went through a process most of 2025 of really trying to figure that out of who am I outside of this global health space and this digital health space that I've spent my career in. And it was really hard. I had no idea. I remember having conversations with some colleagues and friends to say, like, can you please tell me what I'm good at? Because I'm not sure. I don't know what value I'm adding to the world if it's not in this particular space. And, I applied for a few jobs. They just didn't quite feel right. They didn't work out. I was really lost for a period of time. But then I did stumble across, and I kind of knew, this. I knew I wanted to be in this operation, like strategic operations place in a leadership role. I was talking to some health tech companies in the US but the full-time role didn't seem to fit. My family moved to Portugal at the time and I knew I needed something that would allow me to be an independent contractor. And then I came across a fractional COO on LinkedIn. And that again, like similar to when I joined the Peace Corps, it was this light bulb moment for me
Right.
where everything just clicked. And I said, this is it. This is the life that I want, to be able to work as part-time embedded in the leadership team of multiple organizations and to focus on the strategic operations piece to really help move organizations forward. That was like a dream. I couldn't believe that that's something that I could actually do. And so as I started to learn more about fractional work, it just all really clicked that this is exactly where I want to be next. And so
Right.
from then on, I put together a really detailed process to build up my credibility and get to a point where I could actually bring on clients for this work.
Understood. Understood. And before diving deeper into that, um, during these difficult months of 2025, what helped you cope with it?
The honestly, the most important thing that I remember when immediately in these after weeks after USAID was dismantled, like the amount of anxiety that I had and stress was so high. So I just started exercising a lot, like really rigorously every single day. And I've kept that up, and honestly, like putting myself first and my health first. So I started exercising and following a really structured routine that I could follow. I started eating better. I started prioritizing my sleep. I just said, look, if I don't take care of myself right now, I won't be able to do anything for anybody. And so that having feeling good about myself, feeling like I'm, putting in the work to make myself healthy, that allowed me to show up fully. It really reduced that anxiety and stress, and it helped me to see much more clearly where I was going. So I would recommend that to anybody that's struggling, is take time out, put yourself first. Attending another meeting, reading another article, scrolling Facebook, that's not going to help you. But doing a workout, going for a run, getting on your bike, like that absolutely will, and it has tremendous benefits.
Right. And yeah, because I was in a previous podcast as well, I was speaking to a friend of mine, and he had also lost his job with the USAID cuts. And yeah, similar things from him as well, spending more time with family, being more conscious about health, and I think also having a support network around you also helps, right?
Absolutely. Yeah. Yeah. And I was fortunate to have a number of people that were accountability buddies to each other. So we'd have regular calls and we'd actually set intentions to say in the next 2 weeks, I'm going to do these three things. And then we would follow up on that. And just knowing that you're not in it alone was tremendously helpful in those early days. And I will say once I kind of started down the fractional COO path, I started reaching out to as many people as possible that had done this before and just learning from them. And it was so inspiring. And what I found is that people are so giving and open, and that really opened my mind to what's possible. And something I'm trying to do now is to give back to others in a similar point where I can help them by sharing my experience in the hopes that it will give them some hope as well.
Right. And with the coming to the fractional work, um, you had never, like you said, you had never searched for a job before and things like that. And in fractional work, you have to actually pitch yourself and services and things. So, what was the mindset shift there that was needed from your end?
And that's a really great question because I know before I said, like, I don't like the whole getting out there and
Exactly.
selling, but I am not selling. Like, this is the difference. I'm not selling my services. I know the challenges that many early stage startups or small businesses are facing, or social impact organizations. I know, especially now, where the need is for what I provide. I wish we had someone like me when I was going through this at Dietrich. I've been in the role of a CEO. Like I get it when things start to grow and you feel totally overwhelmed because you're trying to do the external stuff and the internal stuff and need a thought partner. So I'm not selling to anybody. What I'm doing is showing the value of the work that I provide. And I've been very, very fortunate in that I've had inbound leads of people contacting me to say, what you're talking about really resonates. I think we need to work together. And that's how I've gotten the business that I've gotten. And so I don't view it as selling. I view it as sharing, sharing my experiences, sharing my point of view, outcomes that I've enabled, and using that as a way to bring people in. Because what I don't want is to ever have to convince somebody that doesn't feel like they need my services to. That's not how I operate. And so I will
Right.
continue doing this as long as I can share that value with others and they see it. And that is the big shift that I've seen.
Right. Understood. And a question that some people have when they are thinking about fractional work, for example, is that, hey, why would someone even want a part-time COO, right? Versus having someone full-time in-house, right? Why would they
Mhm.
even see value in a fractional operator? So what have been your observations around that?
Oh, it's multi-level. So number one, a lot of, especially, and I work with very small organizations that are growing. Like it is
Right.
expensive. If you want to bring
Yeah.
on a really, really experienced and strategic COO, that's a huge chunk of the budget.
Yeah.
You could bring on a junior level operations manager, and they will execute what you tell them to do. But I work with founders and I'm very much a partner with them. I'm a thought partner to them. I help them think through their vision and where they're going and how they're going to get there. I create the structures and then I help the organization to take those on and to go through the change management so that they can actually embed these in the way that they work. I
Right.
can do that in a part-time basis and I can do it really well. You will not get that with a full-time mid-level person and you can't afford it. for a full-time COO. And so I think that is the real value that I bring. And quite frankly, I'm able to then learn from different industries and bring that. So I think I bring more value in an external perspective, but at the same time, I'm an embedded part of the team. I'm not a consultant who's
Yeah.
coming in and just telling you what to do and leaving. I'm helping you, I'm being your partner to think through what to do. I'm building it and I'm implementing it. And that is the tremendous value.
Right, understood. And now you're working, I think, with three companies, right? So
Yep.
now that you are fully into the fractional operations mode, anything that surprised you about fractional work?
Yeah, there's a lot that surprised me. So I'll be totally honest with you. I've spent my career in the nonprofit space, and so I totally had the imposter syndrome of how can I work like shift over into a for-profit startup or a small business that is trying to get more revenue and clients. What do I have to offer? What I have come to realize is that the answer is quite a lot. There's so much that I've done. Almost everything I've done transfers. So we didn't talk about marketing at D-Tree, but we talked about communications and messaging our impact and sharing our value. And that is marketing. The finances. I've done all the finances on the nonprofit side, but when you're a nonprofit, you're still bringing in revenue, and you need to make sure that your revenue is greater than your expenses. And I so much is transferable, and that's been the best eye opener for me is that it's not about a specific sector. These skill sets are transferable across industries, and I can add value in a variety of different settings.
Right, understood. And what are you looking forward to in 2026?
I'm looking forward to a lot in 2026. I'm so excited to start the year. So yes, I have three great clients that I'm working with. Number one is to really help them to achieve their goals. So we're already seeing a lot of really great traction and momentum with the groups that I'm working with. I want to share that more. I think there's so many learnings from this, and so I'm working with a number of other fractional COOs, and we're putting together a series of kind of external roundtables where we can synthesize across industries and show what are the common challenges, what are things that are working to really help others grow in this space. I want to really demonstrate and learn from what I'm doing. There will be some successes, and I want to measure that and see that impact. And there are going to be a lot of failures, and I also want to document that and learn from it. So I kind of want to share openly about my journey in the hopes that either other fractionals or other business owners and founders can learn from that and just contribute back to the field, because I've gotten so much from others that now I want to give back.
Understood. With that giving back thought, my question is, if you had to today go back to Hopkins and give a lecture on the hidden truths of working in the health tech space, especially in a developing country, like what would that lecture contain?
I think what I would talk about is the thing that you don't learn project management. You don't learn operations. I learned a lot about theories of change and a lot about biostatistics and things, and very theoretical sense. But then I think everyone in that space realizes when you get to a project that you need to deliver on, you need to understand finances, you need to understand operations, you need to understand culture and, how to grow a team and build leaders. Like these are the things that are transferable across industries. But if you can really hone in on those and you bring that to the nonprofit space or the health tech space, that's how organizations succeed. And that's what's often missing.
Right. And so if I am a youngster wanting to enter the space, how do I build up those skills?
Again, I think so. Learn from as many people as possible. So there's so many great podcasts out there. That's for the fractional work. There's a podcast that I've listened to every single
Mhm.
episode, and I've learned so much from. There is so much content. So
Which one is
figure
it?
out who. It's called it's through Bradley Jacobs, the Six Figure Secrets for Fractional Leaders, or sorry, I think is the
Okay.
title. I mean. I would recommend it to everybody. Listen, read, find as many books as you can. I know a lot of people don't like to read anymore, but there's so much power, even if it's an audiobook, like consume, consume information and talk to people. I think the most important is just to get out there and understand people's experiences and then try it and learn from it and be open to the fact that you're going to fail again and again and again. And then you're going to get it right and something's going to click, and you have to have that persistence to continue on in order to really survive and to have an impact.
Right. And another thing which is not talked about as much is failure, right? Especially in college, you never learn about the fact that once you start working, you will encounter a ton of failures. And how do you
Mm.
how do you accept that or get ready for that or prepare for it? Because in my experience, I've seen people who were, A grade students in school, college, and everything. Once they entered the workplace and started facing setbacks, it was a big transition for them. Like any advice for students or youngsters wanting to enter into this profession? How do they set themselves up for being okay with failure?
Well, let me let me take it way back. I mean, I'm a mom of two small kids, and I think it starts from early ages. Like we have to be willing to let our kids struggle and fail. And that's something in modern parenting that we often want to kind of jump in and fix things immediately. I mean, it's that mentality all through life is it's okay to fail and celebrating failure and developing that grit that things are going to be tough and you're going to keep going. If you haven't had that kind of an upbringing, I think just reframing what failure is. Failure is not the end of the world. Failure is a very good thing because you really do learn from it. And I think having that reframe of, yes, this didn't go as I wanted, accepting the feelings that you have when something isn't right. I mean, there's a lot of discomfort in this work and there's a lot of feelings that are not going to feel good, but recognizing that this is part of the process and being okay with that and then picking yourself back up and moving forward. I mean, that's the only way to do it and just to embrace it as part of the process.
Understood. Erica, final question for you. What makes you happy these days?
What makes me happy these days? Gosh, so much, really. I think, it's I didn't talk much about it, but we moved to Portugal a few months ago, and that has been just a game changer. I feel like I have designed my life in a way now where I'm doing work that I'm so inspired about, but I also have time with my family. And, we go to the beach after school. We pick the kids up and go to the beach on a weekday and we take time together. And I feel like I am finding that balance. I'm doing work that inspires me. I'm living in a place that inspires me. And that really lights me up. Like I feel like I'm living in a dream.
Wow. On that positive note, thank you so much, Erica. I really enjoyed our conversation.
Great. It's been great to talk to you today. Thanks so much.